Hey there, it's Teresa here. Thank you so much for joining me. Hi, I'm Teresa Younkin. I'm a healthcare informaticist. And what that means is that I work with the business side of healthcare and the IT side of healthcare. I speak both languages. I do the translation, bring them together so that we can create projects and products that are going to be beneficial to our end users. And that is our patients and members. Last week, I talked about AI agents. Now, AI agents are algorithms and processes for one specific task, and they can come in a variety of different models. If you want to find out more about them, you can listen to last week's recording. I wanted to carry it forward this week with a real life example. So my daughter went in for a very simple wrist surgery on Friday. When we got there on Friday, we go through all the usual processes, and I'm her caregiver. So as the surgery proceeds, they come out and they let you know what happens. And when they get ready to discharge her, as she's in recovery, the discharge nurse comes out and she gives me the instructions. So as I'm looking through the instructions, she keeps saying this about a shoulder and that about a shoulder. And I know that the doctor who did the surgery is a shoulder specialist. So I'm thinking this is a little bit strange. She had wrist surgery, not shoulder surgery, but we'll roll with it. I've been through many surgeries to understand that, the aftercare treatment is generally the same, right? Keep the wound dry, make sure that you're drinking lots of water afterwards, make sure that you're feeling okay and that you're protecting it until you get to your next appointment. As we keep walking through this, I'm thinking to myself, check, okay, like, don't listen to that, but listen to this. Like, write something else here. So these systems could actually flag any discrepancies in the information that's been provided. When you do that, you can ensure that your patients are receiving accurate and personalized instructions that are tailored to their specific procedure. But it's not only just that. AI can really just play a crucial role in enhancing patient education and their engagement. We can use NLP, natural language processing, and we can use those machine learning algorithms, bring them together so that we're delivering personalized educational content in a format and the language that your patient understands. If we wanted to take this one step further, what could we imagine? Well, one of the things that we could imagine would be getting real time updates and reminders on your smartphone that could actually guide you through every step of that healthcare journey. You can start with the medication reminders. Boy, when you leave the hospital and you're coming out of that anesthesia, even if it's light anesthesia, you don't have a lot of really good memories. And the people who are with you are a little bit flustered to remember everything that they've been told, especially if every time that I look at this piece of paper, it says, it's telling me, ignore that part, but just do what the doctor said. So now I'm like trying to remember all these different conversations. And then I think to myself, am I really delivering the best care for my loved one? When it comes to those medication reminders, think about when you leave the hospital, they tell you, well, wait, you have to go pick up medication. And then how long after do you take this medication? You can use these large language models to get the best and the most optimal treatment regimen. What about dietary recommendations? You know that when you go under anesthesia, everything slows down. And then on top of it, you're taking narcotics, which slows everything down even more. Why not only give the patient medication reminders? How about dietary recommendations to help them help themselves? You know, AI can empower patients to take control of their health like never before. They can be active, engaged participants in their own health care. So, while my experience with getting those incorrect discharge instructions was certainly frustrating, it also served as a reminder of the immense potential that AI can hold in transforming the patient provider relationship. By harnessing that power of AI, we can build healthcare systems that are not only efficient and accurate, but they're also compassionate and truly patient centered. Thanks for joining me. I'll see you guys here again next week.